What is a kidney stone? A kidney stone is a hard mass developed from crystals that separate from the urine within the urinary tract. Normally, urine contains chemicals that prevent or inhibit the crystals from forming. These inhibitors do not seem to work for everyone. However, some people form stones. If the crystals remain tiny enough, they will travel through the urinary tract and pass out of the body in the urine without being noticed. Kidney stones may contain various combinations of chemicals. The most common type of stones contain calcium in combination with either oxalate or phosphate. These chemicals are part of a person's normal diet and make up important parts of the body, such as bones and muscles. A less common type of stone is caused by infection in the urinary tract. This type of stone is called a strovite or infection stone. Another type of stone, uric acid stones, are a bit less common, and cystine stones are rare. Kidney stones in the kidney, ureter, and bladder. Urolithiasis is the medical term used to describe stones occurring in the urinary tract. Other frequently used terms are urinary tract stone diseases and nephrolithiasis. Doctors also use terms that describe the location of the stone in the urinary tract. For example, a ureteral stone or ureterolithiasis is a kidney stone found in the ureter. Gallstones and kidney stones are not related. They form in different areas of the body. Someone with a gallstone is not necessarily or more likely to develop kidney stones. Who get kidney stones? For unknown reasons, the number of people in the world with kidney stones has been increasing over the past 30 years. By the early 1990s, the portion of the population with the disease had increased a lot. Stones occur more frequently in men. The prevalence of kidney stones rises dramatically as men enter their 40s and continues to rise into their 70s. For women, the prevalence of kidney stones peaks in their 50s. Once a person gets more than one stone, other stones are likely to develop. What causes kidney stones? Doctors do not always know what causes a stone to form. While certain foods may promote stone formation in people who are susceptible, scientists do not believe that eating any specific food causes stones to form in people who are not susceptible. A person with a family history of kidney stones may be more likely to develop stones. Urinary tract infections, kidney disorders such as cystic kidney diseases, and certain metabolic disorders such as hyperparathyroidism are also linked to stone formation. In addition, more than 70% of people with a rare hereditary disease called renal tubular acidosis develop kidney stones. Cystinuria and hyperoxaluria are two other rare inherited metabolic disorders that often cause kidney stones. In cystinuria, too much of amino acid cysteine, which does not dissolve in urine, is voided. leading to the formation of stones made of cystine. In patients with hyperoxaluria, the body produces too much oxalate as salt. When the urine contains more oxalate that can be dissolved, the crystals settle out and form stones. Hypercalciuria is inherited and it may be the cause of stones in more than half of patients. Calcium is absorbed from food in excess and is lost into the urine. This high level of calcium in the urine causes crystals of calcium oxalate or calcium phosphate to form in the kidneys or elsewhere in the urinary tract. Other causes of kidney stones are hyperuricosuria, which is a disorder of uric acid metabolism, gout, excess intake of vitamin D, urinary tract infections, and blockage of the urinary tract. Certain diuretics, commonly called water pills, and calcium-based antacids may increase the risk of forming kidney stones by increasing the amount of calcium in the urine. Calcium oxalate stones may also form in people who have chronic inflammation of the bowel or who have had an intestinal bypass operation, ostomy surgery. As mentioned earlier, steroid stones can form in people who have had a urinary tract infection. People who take the protease inhibitor indinavir, a medicine used to treat HIV infection, increase the risk of developing kidney stones.